Bottle feeding can lead to gagging or choking sounds, which is alarming if you are a new parent. Choking is a serious and life-threatening problem in babies, especially during bottle feeding. If the bottle is held at an incorrect angle or position, the milk can flow too quickly and causing the baby to choke. Some babies have a condition called gastroesophageal reflux, where the contents of the stomach flow back up into the esophagus. This can cause choking or gagging during bottle feeding. If the nipple has a large hole or the flow rate is too high, then it can also cause the milk to flow too quickly, which making it difficult for the baby to swallow. Some babies may have an allergy or sensitivity to certain ingredients in formula milk, which can also be a reason of choking or coughing. Babies with respiratory issues such as asthma or bronchitis may have trouble in breathing during bottle feeding, which can lead to choking. Babies have a natural reflex called a tongue thrust, where they push their tongue forward while feeding. If the tongue thrust is too strong, then it can also cause choking or gagging. There are some tips to prevent choking while bottle feeding. You should always use a bottle with a slow flow nipple. A slower flow allows the baby to control the flow of milk and reduces the chances of choking. Always hold your baby in an upright position with the head slightly elevated. This allows the milk to flow downward and makes it easier for the baby to swallow. If the bottle is held too high, the baby may suck in air instead of milk, which can lead to choking. And always take frequent breaks during feeding to allow the baby to catch their breath and swallow. And also gently burp the baby between feedings to help release any trapped air. You should always supervise the baby while feeding and watch for signs of choking such as coughing, gagging, or difficulty in breathing. Never force your baby to finish a bottle or push the nipple into their mouth. This can also cause the baby to choke or overfeed. Milk that is too hot can burn the baby's mouth or throat, which causing them to choke. If your baby is choking during bottle feeding, then stop the feeding immediately and seek medical attention if necessary. By following these tips, you can prevent choking while bottle feeding.